This is to give you an overview of bone marrow transplantation at Christian Medical College, Ludhiana, Punjab. We started our transplant program in 2008. We had a 2-room transplant unit in Ward 15 to start off with, and subsequently in 2013 we moved over to this new area where we have 5-bedded transplant unit. We have now done 99 transplants over the last 8 years, and a majority of our transplants have been for thalassemia patients, and thalassemia remains one of the major problems in Punjab because of the carrier state frequency is very high, and if 2 carriers are marrying, the chances of getting a thalassemia major patient is about 25%, and that is something which we are doing the preventive measures, but at the same time to offer cure, this is the best option out in terms of transplantation, especially if they have HLA identical sibling. We do both matched related and matched unrelated donor transplantation. And unrelated is offered essentially for patients who do not have a sibling match in their family. And we usually do an extended search among the parents and the first cousin if there is an intermarriage between the father's or the mother's siblings. And we have got a few transplants like that now. And it is important to do the extended search, and we get stem cells have been flown in from Germany, US and many parts of India. And we've been able to do this transplant with a good team work. We have 2 doctors with us, Dr. Chepsi, who's done his DM in clinical hematology from CMC Vellore, and he has joined us about 1.5 years ago.
Hi, returning to CMC has always been an aim when I did my MBBS as well as my MD. And it is the challenges of treating patients here which really gives you the satisfaction. Like centered around one of the industrial terms, to treat patients with hematological disorders, to arrange finances for them, you come to know your depth of involvement with these patients are very satisfying. You know, facing donors, lack of money are definitely challenges, but despite that, I am so happy to be part of a team which is growing, treating more patients, fulfilling the legacy of Edith Brown, and so happy to be part of this legacy.
And we have Dr. Amrit, who has been with us for the last 5 years now. Dr. Chepsi's interest is in leukemia and in haploidentical transplantation, and he'll be going for his advanced training very soon, and he should be able to come back and we can start a program very soon. Dr. Amrit's interest is in transition care in thalassemia and also in immunodeficiency transplantation.
I've been here since 2011 in the hematology department. Before that I was in pediatrics since 2009. I've been working with Dr. Joseph, and it's been a great pleasure to work here in this department, and being in CMC, close-knit group, really love the place since 2011. And it's been a journey from a 2-bedded BMT department to a 5-bedded department. A lot of pediatrics to take care of. I actually thought in the beginning it would be only adults, but then been a good number of patients who I'm taking specific care of. The family in the department, I would call it a family because we have a lot of friends rather than colleagues. I really like that about the department. The nursing, the physician assistants, we've been very close-knit group. Like the place for the type of patients I've seen, and the way we have progressed, I really like that. I think there's a lot more to come, and a lot of developments, research. Really like that.
And we also have an able team of physician assistants and the nurses. The nursing is headed by Ms. Sangeeta Samuel, and she has been able to train a lot of nurses in advanced training in transplantation. She will also be getting a short training in US very soon.
We have 15 well-trained nurses here. We are the advocates between the doctor and the patient, because the patients stay here for more than 30 days with us. We are able to build up a good rapport with them. So we are able to meet their educational needs, emotional needs, psychological needs, and all those needs apart from the basic nursing care that we give. And all the nurses here are well trained. We have a very planned educational program for them. They also attend conferences and workshops nationally and internationally. And we have excellent nursing staffs who have been able to provide good care, and all our alumni from here have gone abroad also and they're doing well in other areas.
So when we come in, we need to wash our feet. So we have a tap here. So in the no-touch technique on the legs, we can wash our feet first. And after that, we are expected to wash our hands. And we will take some liquid soap and wash our hands. And we have a protocol here on effective steps of hand washing. These are the 5 rooms we have, and one is the apheresis room. And we have 501 to 5, 3 rooms on this side and 2 rooms on this side. This is Vanya, who has been suffering from thalassemia, and her sister, younger sister, who is 2 years old, is HLA identical, and she will be the donor for 1 year. We'll be starting the conditioning from tomorrow. By next week, the donor will be taken to the theatre, and the stem cells will be collected in the theatre, and subsequent day we will be transfusing it to her. He had Hodgkin's lymphoma, which was refractory to initial treatment. Now we've got into remission, and last week we collected his stem cells and froze it down. Right now he's getting his chemotherapy, and that will be infused on Tuesday. On Tuesday it will be infused. We hope to become one of the sought after transplant centers in northern India in the future.